With Mr. Todd Archer again at the SIA conference in Arizona 2011. Thanks for being with me, Todd.
You bet.
I'd like your viewpoint on what thing you think needs to happen to really help improve the cost of health care and the availability and scope of services in this industry.
Sure. The biggest component that we need is cost transparency from the provider side. You know, obviously healthcare is a significant part of the U.S. economy, and yet it's the only part of our economy where when someone consumes a good or a service in our segment, they have absolutely no idea what the ultimate cost of that product or service is, and there's no way for them to easily obtain that information. The same thing holds true for quality measures as well. So not only do they not know what the cost is, they don't know what the relative quality is of the entity that's providing the care to them. And in order for us to make a significant impact on the overall cost and quality of healthcare in this country, we're going to have to open the doors on the pricing and on the quality measures so that the individual consumer knows what the cost is of what they're consuming and what they're getting for what they're paying.
All right, Todd, on that point, the consumer, this is the only industry I know of where the consumer goes in for products and services and doesn't even care what the cost is. They just want the service and the products. They don't ask what it costs. I do know they care about the quality of the provider. They want better facilities, better doctors, given the choice. That's a big issue about what type of insurance, if any, you have, is can you go to any doctor you want? So the consumer wants freedom of choice. But how do you get the consumer to ask what things cost or care about costs? How do we ever get that component in? So it's one thing to have provider transparency, but if the consumer's got health insurance and or Medicare or Medicaid coverage, how do you get them to care about what it's costing?
Well, you know, obviously there are theories on how that works. You know, from a pragmatic standpoint, I believe most of that's going to become they have to have some stake in the game. You know, even the consumer today, they have no clue what the ultimate cost of any of those procedures are because they only know what their deductible, co-insurance, or out of pocket if it's a large enough claim, what that is. But oftentimes they really have no concept of what the ultimate cost of that encounter was. So obviously having skin in the game, having the pain level be at a point where it gets their attention, they go, I need to know what this is costing me. But then also we have to utilize technology better to be able to deliver that to them in an easy to consume fashion, because right now the technology is not where it needs to be in order to do it. We can get it there, it will just take a little time.
All right, well, you as a TPA are helping the employers, who especially the ones who are self-insured.
Correct.
And or utilizing captives. They have a vested interest in cost of services.
Absolutely.
And scope of services and options available. So you're helping them migrate down that path, I assume.
Absolutely.
Yes?
And there are tools available that are being perfected that will enable the individual plan member better understand what the costs are and then what the quality measures are that are associated with that treatment that they're receiving.
Okay, in the 30 years you've been in the industry, are you seeing increased legitimate, interest in both safety and wellness related programs to address both comp and health insurance related costs?
I think so. Obviously the workers' compensation market is well ahead of the healthcare space as far as understanding the best way to manage a claim is to avoid it in its entirety. Obviously, in a workers' comp environment, you control the environment that the worker is operating in. In healthcare, not so much, because once they leave the office, you don't have any control over what's going on with them outside their employment. And so there's some additional challenges that we have to deal with on the healthcare side. But certainly I think there's a growing realization that in order for us to really do this and do it right, we're going to have to address the whole wellness issue of making sure that we're keeping our people well to avoid not only the medical claims, but also there's cost reductions on absenteeism, presenteeism, and other things in the HR realm that really are not directly benefits related.
All right. Thank you very much for your time again, Tom.
Thank you.